So we're at this time when we have more positive cases reported. Then there's the quarantine and isolation guidelines for those without symptoms, just recommended by the CDC, shortened to just 5 days. What changed?
Well, the reason is that now that we have such an overwhelming volume of cases coming in, many of which are without symptoms, there's the danger that this is going to have a really negative impact on our ability to really get society to function properly. You're hearing reports from cities throughout the country of substantial percentages of firefighters, policemen, people with critical jobs who are infected and required to stay home in isolation for 10 days. So the CDC made a decision to balance what's good for public health at the same time as keeping the society running. So the decision was made, instead of having a 10-day isolation, if you are without symptoms, namely you feel well, that instead of being 10, you would stay for 5 days in isolation, and then you could go out into the community and do your job, provided you very consistently wear a mask. And they thought the balance of those two was the appropriate and prudent balance to keep people safe at the same time as you do not drain society of their very critical workers.
I think a lot of people would have hoped that this would happen much sooner. Do we know more now about asymptomatic patients not being as contagious as before?
No, it's not a question of asymptomatic people not being as contagious. It has to do with the duration of the time in which you are contagious. So we know that if you get infected now, you don't have the same level of virus in your nasopharynx nor potential to transmit it when you compare the first 5 days with the second 5 days. The first 5 days, it's much more likely that you have the capability of transmitting it, whether you're with symptoms or without symptoms. But as you get into day 6, 7, 8, 9, 10, and beyond, the likelihood of your being able to transmit it, you might still be infected, but the likelihood of your being able to transmit it to someone else diminishes considerably in those second 5 days.
Do you think that it seems as though there is this disconnect or a dissonance in the medical community, because you have some people speaking out saying this is dangerous, that we're reducing this isolation time? What do you think is the issue here?
Well, it may not have been as communicated as well by the CDC when they came out with it. I think now that's the reason why you have people like myself and Dr. Walensky out here talking to you in your program to try and explain that there was a rationale to do that. The CDC thought it out well. It's not 100% risk-free, but then again, nothing is 100% risk-free. There are so many people walking around in society without symptoms who don't know they're infected, and they're infecting other people. This is a highly transmissible virus. So when you have someone that you know is infected, as long as they're without symptoms, it was felt to be prudent, keep them isolated for 5 days, and then in the second half of that 10-day period, when the likelihood of transmission is extremely low, let them go out with a mask, being careful, so that they could fulfill their job in the society to keep society going smoothly.
Well, we've obviously seen the economy here ravaged by the pandemic. How much do you care about business returning to normal?
When you say, how do I care? I'm a citizen of the country. I care about everybody else, but my job as a public health official and a physician and a scientist. So my job is to make sure the health of the country is preserved. But of course, we're all negatively impacted when the country gets into trouble economically.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.